So today will just be my student. We're going to do one-on-one lecture about the proper medication administration and the 5 rights of medication administration. Oh, so let's say 5 to 10, because initially it started at 5, and then now um, it's 10. Are you there?
Yeah, I'm listening.
It's echoing. All right. So, can you give me at least one patient's right in terms of medication administration?
Oh, right of proper identification, right of drug, right of dose, time, date, documentation,
Right.
right of health education.
Okay.
What else? What did I forget?
Okay. So, the thing that you forgot is the right assessment and
Identification.
right identification falls into right patient. Okay. So, let us first identify the first one. What is the first thing that you do before giving medication to the patient? Do we go directly to the patient and just tell them that, okay, this is your medicine? What is the first thing that we check to the patient?
Actually, you have to verify first the doctor's order.
All right.
And after that, you have to verify properly the identification.
Correct. How do you
That's
identify the how do you check the proper identification of the patient?
actually the common is, of course, the complete name
All right. We ask for
and then the
name,
date of birth.
the date of birth.
But if the client wasn't able to or cannot provide, verbalize their names, you can double check with their pictures provided
Yes.
in their data.
Okay. So basically, in the Philippines, we are using the in first we ask the name of the patient. We check the wristband, isn't right? We check for the wristband of the patient, and um, I guess we do have something like an MRN as well as one of our identifiers. That is in UAE though, but I'm not sure now in Philippines if there are any changes. Here in US, basically they don't use any MRN numbers. They just base on the patient's name and then the room number and the picture as well as the date of birth. So that is very important to know. So sometimes the patient gets confused, and when you ask their name, they don't give their complete name. So if they don't give their complete name, just double check the picture if they're the one. Because once you have given the medication on a wrong patient, then that is considered as, you know what are the possible consequences if in case you misidentify your patient. Can you tell me what are the possible consequence of misidentifying your patient?
Oh, is it malpractice or I think malpractice or negligence?
Both.
Both. Negligence and
So here
malpractice.
in US, there is um negligence for the sake that because you failed to identify your patient properly or correctly, and malpractice as well. So that is the thing. So first, we always check, double check, triple check that you have the right patient. Second is that you check the patient chart for the order. So you double check, is this patient is for me? You match, you verify this is the right patient and this is the medicine that I have to give, and that's it. And the third is to check the medication with the order. Check if it's correct. And then make sure you're entering the right patient's room. Sometimes patient can be relocated into another floor, right? So sometimes we cannot base the room if they're the correct patient. Especially those patients who are on a short term like transitional care unit. So they come and go. So we don't base on the room number. Check patient's armband. What if there's no any armband? So I don't think that that is also a basis. Patient can just simply remove the wristband, and there's a tendency that you can't identify them based on their armband. So the best thing is to check the patient name or ask the patient's name. Second thing is the right drug. So there we do have some that sound like medications, sound like medications, like for example, oxycodone. Oxycodone. What is oxycodone?
It's a
Any
narcotics.
narcotics? And what is ondansetron?
Or then Centron, is it a pain reliever or not? Is it an opioid? No.
Ondansetron. We have used that one for like something like omeprazole or something. Yeah, something
Oh,
like
it's same like a PPI?
something. Yes, yes. It's also for nausea, vomiting. So that's the use of ondansetron, but they look and sound like the same. So one time when I was so tired and I have this so much patient in my unit, there was this one instance that I mislook almost the name of the medicine as a PRN and an oxycodone. They look same, but sometimes you might mislook, or it might sound same. So that is the thing that we have to verify and double check, triple check, especially the narcotics. We do have some cases over here in US that nurses are being sued for giving the wrong medicine. So it is relevant to identify or know what is the exact medicine that you're about to give. The brand, the generic name, the order may have the brand name, and the drug dispense may be generic form, but also the generic name of one drug may look almost identical or same to the generic name of another. So you must read medication orders, drug labels carefully. The third is the right route, right route, right route. All right. So what do you mean by right route or right route?
Right route is how do you give the medication? Is
How
it
the medication comes or enters our body. So when you say IM, what are those parts that we supposed to give the medicine? When you say IM means intramuscular. So basically, how do we give, if in which part of the body are we? I mean, which part of our I mean, which part of the body of the patient you must give an IM medications? Of course, you will not go 45-degree, right?
you'll
The
go for 9?
degree is what type of route?
It's 90-degree, and then it will depend. You can give it to the delta. It depends on the amount.
Yeah, 45 degree is sub-Q, right?
45 degrees ague.
So there are some medicines that we cannot go and give it without give it in a wrong. I mean, we cannot give it in a different way. If it says subcutaneous, you have to double check the medicine and you have to be sure that you're giving in the right route. So there was this instances that the potassium chloride, we do have that one, an experience in one of the government hospitals in Philippines. We will not mention the name of that one, but the potassium chloride was given in a bolus. So in a bolus, which is supposed to be given as a side instead of a side, I mean in a piggyback form instead of bolus. So tendency is that the patient died for giving that in a wrong route and a wrong way. I mean, so it is really important to double check how, if you're not sure, be sure that you're giving it in the right route. Always check the order to make sure it includes a right route. If the order has no route, what do you do? Or if you see that the order has no route at all, would you just give it to the patient just because it's written in the box, or but it doesn't show in the chart? How would you deal with that?
You have to clarify and verify to the doctor.
Correct. So it is very relevant that you call the prescriber or the physician, whoever made that order, check, be sure. And how do you for example, there is a medicine that you have to verify and it was given by phone call. So how do you deliver, or how do you verify that telephone order to the patient? I mean, to the physician.
I don't know with the other country setting, but in the Philippines, I think they do a pencil mark first, and then within 24 hours they need to order it personally to the chart of the client. You have to make sure that the doctor will write uh, write it in the chart of the client within 24 hours
Correct.
to make it
So
valid.
yes, you're right with that one. So we do, so for example, the physician phone calls, and let's say the physician is ordering warfarin 5 milligrams per rm, every for let's say at this day, every day, and then 2 milligrams on Wednesday, Thursday, and Friday. So when the physician mentions that one and they said repeat the INR result on Friday as the last day prior to discontinuing the warfarin, then you have to double check, doctor, are you telling me that I have to put an order here 5 milligrams today and 2.5 milligrams on these days, and then you want to check the INR on Friday? So you read and then you repeat. So the ones that he, or what do you call this one, read and then repeat what the physician is mentioning. You never assume, even if there is only one route of the administration of the drug, and you need a clear and correct order prior to administration of any medication. Understand? The medication must be
Yes.
given in the route order. So whatever it says, it must be given in that way. However, for example, if the patient cannot swallow pill, you can get an order for a liquid. Also, what if, for example, the patient suddenly inform you that the patient cannot swallow because of some dysphagia, and there's a tendency of choking, but the pill is always given in whole. So how do you do that? Do you give it? Can you give the medication in a whole pill, or can you crush it right away and give it to the patient?
It's depend, like if the pill is in an extended release or a coated pill, I think you cannot crush it It depends on the pill.
Yes. So we do have some medication that we cannot just crush. Like for example, those extended release form of medicine. We do have that one in aspirin here in US. So that's the thing. Another is if there any change in a route, we need to have a new order. We do not make an assumptions that okay, oral and IV are both same because they are totally different. So if there's any changes, we have to be taking again a new order for that one. And there are some instances like for example hydromorphone 4 milligram, suddenly they change the dosage. They make it 2 milligrams. So they discontinue first the 4 milligram and make a new order for another 2 milligram. We don't assume that they can be changed anytime unless if there is a new order. Get it? Another thing is about what about the right time? So talking about the right time, say for example, the medicine is due at 6 o'clock in the morning, and it was uh like um like how can you be sure? How are you sure that you can give the medicine like how late can you give the medicine?
Oh, depends. Like for example, the medication was ordered to be given 3 times in a day,
All right.
and then the first dose was supposedly to be given at around 8 a.m. The next will be like 1 p.m., but you forgot to give it at around 8 a.m. And then you remember it at around 10 a.m. I think you can still give the 10 a.m. Dose, morning dose, then you can a little bit adjust on the afternoon. But if you remember like 12 o'clock, 12:30, 1 o'clock, I think you already missed those the first dose on that day.
Yep. So let me just plug the laptop because it's a bit low button already. Right.
This is applicable in the waking hours.
All
We're
right.
talking about a pill, I think.
So standard any medications that are 30 minutes prior and 30 minutes after the time due time is still considered valid. So we can give 30 minutes prior and 30 minutes before. But there are some instances where in which we are so busy. There are some instances that we cannot give it on the time for as long as there is no any order for example, what do you call this one? Usually the narcotics are PRN. But what if, for example, it's insulin? Insulin, you have, for example, Novolog aspart, we have to give it while the patient is having her breakfast. Warfarin or Coumadin cannot be given as late. So we just have to know which are the medicines that we can give it late and which medicines that are not. So that is the key point. Sometimes, what about like for example, multivitamin? You can give it even at the end of the shift. Yeah. So like those kind of things. But as much as possible, follow the time. What is indicated in there. So we are following our medication regimen. So some medications are needed to be given before meals to be effective. Like what are those kind of medicines that you can give prior to mealtime?
I think those like proton pump,
Yep,
omeprazole.
exactly.
Yeah.
These are the protectors. Sucralfate as well.
Yeah.
Some medications needed to be given after meals or at bedtime. So, like in at bedtime, melatonin, those kind of medicines. The medication record should come with time of administration. But as what I said, sometimes it doesn't happen like that. So if you're late, if it is if the medication was given late, we don't document it at the time that you really didn't give it. You can document the right time that you really give it, and then put then charted late, because there are just some instances that we cannot give it on the right time, but at least we have given. It is important to give the medication at time that is on the medication record, and medication should be given 1/2 hour of the time, like what I mentioned, before or after. However, this does not apply to PRN medication. So there are PRN medications that we can give 6 hours prior. I mean, 6 hours, every 6 hours, and every 4 hours. So like those our pain medications, they are PRN. Tylenol, what else? Oxycodone, hydromorphones, those pain. Uh, I am not sure about Senna. Senna, sometimes they're putting it in PRN here. I guess because there are some patients who are constipating. Okay, so if the medication is ordered every 4 hours and you give medication 1/2 before time throughout the day, you will eventually reduce the window for that medication. Yes, it's true, but it depends. When a medication is ordered every 4 hours, it is because it can safely be given every 4 hours and not every 3 hours or 2 hours. If a medication has an order for a time that is not specific, like for example, hours of sleep, the time is open for for interpretation. Some patient may sleep at 7 p.m. and want their medication at that time. We have some patient as well that they don't want to receive any medication. We have to respect that one. If the patient says, for example, you know that in what do you do, for example, okay? If the patient is due now and you see in the orders that they are due now and the patient refuse. For example, the patient is due for 7 o'clock a.m. medication, and the patient tells you, I cannot take any medicine until it gets 10 o'clock, until I get my breakfast. So, how are you going to convince your patient to take that one, to take that medicine on time that is indicated in the order?
You just have to uh, give further information regarding the specific time that they need to take that. If
Yep,
it is needs to be like before meals or after meals.
exactly.
So giving health teaching or health information or medication information will clarify patient's
Right. So,
the patient's mm.
yes, proper explanation of your right. We have to give more information. Some of the patients, they don't know exactly what the medicines are for. They just want they just know that it should be taken after meals. That's what all of the patients know. It We have to explain it to them that this is how it works and has to be received this time. So if you cannot convince them, we cannot also force them, right? So yeah. So what about right dosage? Right dosage. Uh, the right dose is like how much of medication is supposed to be administered at one time. You may have to perform medication calculations and conversions. So if the patient is pediatric, you have to double check first the weight as well, um, how old exactly the patient is, and then you make some computations before you give that to our patient, because there are some instances also that we are let's say 2 years old, but then the weight is different, so it varies. So this is the thing, we make some calculations and we see how much we give. So far we are not doing here in our TCU computation such like that, because everything has been computed already. Even the pill itself, it's prepared by the pharmacy, so when they deliver it, let's say for example 30 milligrams of like these tablets, it's already prepared when it goes to you. You don't have to slice it, you don't have to make. So I don't know, some of the facilities you have to do half, make half or whatever, those kind of things. You will need to learn conversions. So conversions is important. You have to double check. Does it dosage of medication do not always come from pharmacy at the exact dose. You may need to give 2 tablets or 1/2 of a tablet. So it is important to double check it very carefully that you are giving or preparing the right dosage of your medication. Otherwise, the you are not targeting the right the right medication regimen for that patient. Okay. So there are some instances as well that it comes up with the different uh, the milligrams, like 150 milligrams of oxycodone. We have the 5 milligrams. So you have to really check those prior to giving. You may need to give 2 tablets or 1/2 a tablet. So never assume that you received exact dose from the pharmacy. We have also Tylenol. It comes up with 500 milligrams, and when you give 2, that's 1,000 milligrams. So you have to double check how much of the milligrams you have to give before giving it to the patient, because we have 325, then you have to give 3 to come up with the 975 milligrams. So that's how it goes. Right documentation. So anything that is not documented, what does it mean? Any medication that is not documented, what do we mean with that?
It's not done.
Yes. Anything that is not given, remember this, anything that is that is given but not documented is considered not done. So it is very important to document it. Always record immediately after the medication is given, because sometimes they double check what time it has been given, especially if we do have some instances that the patient has to undergo some investigations, like what time did when the patient had a code blue, and find out and research more about how the patient died. And so they do some investigation at like what time did the patient really receive the medicine. And this comes up like a questions like, why did the patient receive at this time and why it was documented at this time. So we have to be sure that we have given it and documented it on time. Understand? Okay.
Yeah.
You have any questions for that?
So far, no.
Okay. So you must document each and every time you administer a medication. Always check your documentation. Okay, so we're done with that. We go to refusal. So the patient comes to you, come to the patient's room suddenly the following day, and the patient tells you, I don't want any medicine now. I feel like my kidneys is an injury. I feel like my kidneys is just I don't know, I just only have one kidney and I feel like I don't want to receive any of those anymore. So what do you do with that patient now?
At first, you have to assess the complaint first. Of course, you have to address that complaint. But then, if you think that the client's just making some excuses, you can go back later, as long as it's still within the window time that it is still possible to give the medication.
Correct. So when the patient refuses, we have to know the reason why, and uh, the window time frame of giving a medication is will last like 4 hours. So you have that time period to convince your patient. Yeah. Okay. What happened now? It says upgrade. Let me just pause. Stop recording.